Hi guys, I just wanted to talk to you about something that is very important for us healthcare workers, especially the doctors, nurses, and other professionals that are dealing with this virus at the moment, and that is the national and international shortage of masks. So I just want to show you really quickly the two masks that we use in a healthcare setting to protect us from coronavirus. One is the FFP3 mask, which you can see over here. And the other one is an N95 mask, which you can see over here. The N95 is a respirator that protects us from 95 to 99% of bacteria and viruses coming through it. And that's because it has a triple layer inside and then a valve that only allows one-way respiration. Now, the reason I'm talking to you about this is because the national shortage of these masks, not only in the United Kingdom, but also in the United States, is putting healthcare workers at an increased risk while seeing COVID patients. The example I can give you is myself. I am on a shift today on Friday, tomorrow on Saturday, and on Sunday, and I've been given just these two masks for all the patients that I'm going to see. So on a daily basis, I see about 15 to 20 patients, out of which at this moment, we suspect that half of them might be COVID positive. So if I'm seeing 15 to 20 patients every day, out of which half of them are possibly COVID positive, and I'm just using the two masks that I have, I'm not only putting myself at great risk, but I'm putting my family at home at risk, my colleagues, the patients that I see, and everybody in the hospital really, because this is how we spread infection. Now, unfortunately, the issue is not the supply of these masks, it's the delivery of these masks. So it's going to take some time for our hospitals to be re-equipped and restocked. The reasons for that, I don't want to get into. There was a massive delay by the government to do this, even they knew that there's a crisis coming, and this is not only the UK, but also in the United States. But that's a whole different story altogether. Right now, the situation is that we are at an acute shortage of these masks. These masks are not needed by the general public. And I say that because contact precaution for the general public is enough if they wear a surgical mask, since this virus is mostly spread by droplets. So as long as you've covered your face, you should be okay. The reason we need these in hospitals is because a lot of our patients are on oxygen or on aerolizing procedures like non-invasive ventilation. This aerolizes the virus. That means it makes it airborne, which it usually isn't. So if it makes it airborne, means that we can breathe this in, and these masks protect us from breathing those viruses inside us. So why am I talking to you about this? The reason is social isolation is the only way that can buy us time to get restocked with these masks. Social isolation, at least in the UK at the moment, is not happening as it should. People are still going out, bars are still open. As of today, the government has taken a decision to close down restaurants and bars, and that will really help the NHS and help us to give us time to flatten the curve so that we don't get as many admissions as we're seeing at the moment, and we can get time to resupply and restock and then come back and help you with proper equipment. This is the same problem in the United States. It's the same problem in Canada, and it will be the same problem in many other countries around the world. We are in acute shortage of supply. If you guys give us time to restock, resupply, then we can come back, protect ourselves, and protect other healthcare workers and other patients. And you can do that by socially isolating and not really going out, mingling with a lot of people, not going out to restaurants, cafes, to parties, large gatherings. Please avoid that, because that's the one way that you're going to spread this virus. And then you're going to come into the hospitals, and that will burden the healthcare system to the point where we won't have enough equipment to treat you. How does that affect you guys as well? Well, ICU beds are in a shortage already, all across the United States, all across the United Kingdom. The more the patients that come in that require ICU beds, the more patients that we're going to have to deny ICU beds to. And that's going to create problems because those patients might not survive. So if you think that you're not doing this for yourself, do this for your vulnerable family member. And also, I just want to refer to this myth that patients under 40 are not vulnerable. In the ICU in our hospital, we have 3 patients that are under 40 and that are on ICU query COVID. I know that patients in London have died that have been under 40. I know patients that have been absolutely healthy and have gotten COVID and were very seriously infected, and they had to be intubated So this myth that patients that are only aged or vulnerable or immunosuppressed are the ones that will deteriorate is not true. So please take this in consideration. Tell your family members, friends, relatives, if they're going out in large gatherings, please advise to them that there are people that are working in hospitals that have an acute shortage of equipment, and we need time to stock up. So please advise them to limit their gatherings so that we can get some time by flattening the curve, and we can get some time to protect ourselves, our family members, and our colleagues. 3 of my colleagues are already gone sick. If I go sick, then my team gets burdened as well. So we all need to work on this together, guys, and we appreciate as much help as we can get. Thank you.